Good morning, Michelle. How are you?
Good morning, Glenn. Great to be on with you.
I wanted to, I'm going to get to some of the things that are happening in your life and some of the questions that I have for you. But I want to start back first on the Newt Gingrich interview. Here's how he answered about fiscal conservative policies. Listen to this. You said if you are a fiscal conservative who cares about balancing the federal budget, there may be no more important bill to vote on in your career than in support of this bill. This was what you said about a new entitlement Medicare prescription drug program.
Which also included Medicare Advantage and also included the right to have a high deductible medical savings account, which is the first step towards moving control over your health dollars back to you. And I think it was a very important distinguishing point. On the drug benefit, my position is very straightforward. If you're going to have Medicare, which was created in 1965, and it was created at a time when, frankly, drugs didn't matter. There weren't very many breakthroughs at that point. To take a position that we won't help you with insulin, but we'll pay for your kidney dialysis, is both bad at a human level and bad at a financial level.
What's your response to that?
Well, my response is it doesn't help to have a frugal socialist. That's really what we're talking about, is managing socialism and trying to be a frugal socialist. What we need to do is take...
Hang on just a second, because I have a feeling that's a headline. Did you just say that Newt Gingrich is a socialist?
What I'm saying is that I'm saying a frugal socialist, yes, because you're looking at proposals and programs that are, in effect, redistribution of wealth and socialism based. And are we going to have real change in the country, or are we going to have frugal socialists?
So your response as now somebody who is going to say, no, I'm not going to do that, what would you do?
What I would do is have free markets in healthcare. That the problem has been the federal government intervening in the free market system in healthcare, and that has driven the cost up everywhere. And so what we need to do is go back to allowing people to buy any health insurance policy they want anywhere in the United States with no federal minimum mandate requirements.
So across state lines,
and then pay for their policies with their own tax-free money, their copays, their deductibles, anything that's related, and then have true medical malpractice reform, because the real problem in healthcare is cost, and it's the federal government that's driving up the cost.
Tell me what you know about Theodore Roosevelt and progressivism on the GOP side.
Teddy Roosevelt was a progressive without a shadow of a doubt. There were good things about Teddy Roosevelt. He was very pro-family, for instance. He was very pro-family, pro-children, pro-marriage. But he was also wanting to build up bigger and bigger government programs. That was his thing, is that he wanted more government intervention.
Newt Gingrich told me that, because we played the audio of him saying that he's a Teddy Roosevelt kind of guy, but he claims that he is the early Teddy Roosevelt kind of guy, which the seeds are there for. I mean, you don't change that much in a 5-year period. The seeds were all there for a stated policy by 1910 of new nationalism. The progressive movement, as we understand it, at least the way I understand it, is moving towards a global government. The GOP is one that says it will be based in America, but we are going to lead the world through nation building and everything else. The left, progressivism, believes in a global government that is really started with the League of Nations, but now is the United Nations. Correct?
Well, and that's not what we want to have. And there was a book that Newt Gingrich has written a foreword to with Alvin and Heidi Toffler, where they were promoting that idea of transnational government, which a lot of us would see as a one world form of government. Whether you're united on economic policies or on political policies, it's still the idea of denigrated United States sovereignty. I believe in United States sovereignty, and that's what I want to uphold.
What was the name of Pat? Do you remember, or Stu? Do you remember what was it? Harold Coe that was remember he was brought into the Obama administration?
KOH.
Yeah.
And that was his thing. He wants to erase the boundaries and erase the walls of American sovereignty and move the United States toward transnational governments, which, again, a lot of people call one world government.
Okay. Let me go to some audio. You've been hit now twice on this, and people are using kids to attack you. We don't have the audio. Do we have a transcript? Go ahead.
No, we do.
We do.
It's hard to hear because obviously the kid doesn't want to say this.
That's right. Well,
right?
His head was down. He was looking at his toes.
Yeah. The kid.
Explain the scene, and then we'll play the audio.
Yeah.
Explain the scene.
You're at a book signing. Is that what it was,
right.
Michelle?
I just wrote a brand new book. It's called Core of Conviction. It's my story. I was in South Carolina. We were at a book signing, and a mother and his son came up to the book signing table, and I reached down to shake the little boy's hand. He was a cute little boy. And he just was barely above an audible whisper, and he said something to me, and I couldn't hear him, so I leaned over the table, and I put my head down to say, "I'm sorry, I think my ears were too far away. What did you say?" And I asked him to repeat it 3 times because I couldn't hear him, and even the 3rd time, I wasn't really sure what he said. And I smiled, and I looked at his mother, and I said, "I'm so sorry, I can't hear what your son is saying." And anyway, then they walked away.
Okay, so here it is.
Here's part of
You
it.
can say it louder. Go ahead. No, it's all right. You said it, but you know, I think my ears were too far away. Do you want to come a little closer? Okay.
My mom gave it to me.
How old?
So he's 8 years old, and he says, finally whispers in her ear, and he's not even looking at you. He's looking
he
away
was
from
looking
you
down at
as
his
he
toes,
says, because he doesn't want to do this, and she forces him in. I think this is shameless. But he finally says, "My mommy's gay, and she doesn't want to be changed." Is that what he says?
So, or something about fixing her, or something like that.
Yeah.
That's what I heard afterwards.
Okay.
And so
this is a recurring theme with you. This is how they are coming, and they're coming with children to attack you on this. How are you? This is the nuclear bomb in politics, accusing you of a homophobe or whatever. They'll do this to anybody they want to destroy. How do you navigate in that kind of world where you're being, I think, set up every time to look like a homophobe? Are you a homophobe?
Well, of course not. I believe that we love all people, and I do. I love everyone. I don't necessarily agree with them, but I love them. I'm kind to them. I'm gracious to them, because the golden rule is treat others as you want to be treated. And that's how I treated this young boy, and that's how I treated the mother. And, continually the agenda-driven community wants to climb up on my platform and make their issue my issue and try to paint me as someone that I'm not. And, they'll continually try. They have been all summer since this last summer. And this is just the latest. But I agree with you. I think it's shameless to use a little boy and to put that little boy forward to advance an agenda issue.
Where do you stand on gay marriage, then?
I oppose it. I believe that marriage should be between one man and one woman. That's
why?
Why? Well, because number one, it's foundational in the scriptures and in the scriptures of Christian and Judeo. And if you go through the major religions of the world and really through 5,000 years of recorded human history, you can't find a tribe or a nation or a people group where marriage has been anything other than between men and women. Now, some have had more than one man or more than one woman, but it's always been between man and woman.
Do you believe in
I believe it's morally right.
Do you believe civil contracts or civil marriages or
unions? Civil unions?
I don't because I think that they are the equivalency of marriage.
What about rights for, one of the things that is talked about is that they can't visit their loved one in the hospital.
I have gay friends who have been together for years and years and years. One of them can't go visit the hospital to the other one. That's wrong.
Well, I think that that's something where when you go into the hospital, you can designate who you want to have come.
And to whom you want to leave your money. And
that's right.
All of those things.
It's a contractual situation. And whether you're heterosexual or homosexual, you can have contracts. And the law needs to apply the same to all people. We have equal protection under the law. The area where I think the gay community would say they're unequal is that they don't have the legal right nationally to be able to marry people of the same sex. They have access to the same law laws of marriage, but the restrictions apply to everyone. You have to marry someone from the opposite sex.